Hi, and welcome back to Kentucky Health Solutions YouTube channel. This is the second video in our Medicare 101 series. My name is Justin Alds, and I'll be presenting this today. So again, this is just another educational video going over some more options for Medicare coverage. So this is right where we left off last time, so we can pick up and continue. So your options for coverage, like we had briefly talked about in the last video, is you can do a Medicare supplement or Medigap plan with a standalone Part D drug plan, so that's two separate policies. That's why you'll see two different boxes on that option one side. Now your option two is the Medicare Advantage plans, which I'm sure you've seen advertised a couple of times. And those plans are also called Part C, which they're usually going to combine your A and B, have your drug coverage there, and may offer some of those additional benefits that were not covered under Part A and B, again, in that previous video. So if you haven't watched that one, go check it out. So Medicare Advantage, or Part C, it's another way to kind of get Medicare benefits. So rather than having your original Medicare with A and B, so having your Medicare card, having a secondary Medicare supplement or Medigap card, and your prescription drug, it kind of rolls everything all into one. You're still in the Medicare program. You still have all the benefits of a Medicare beneficiary and all the rights associated with that. It's just a different option of how to get stuff covered. So benefits are administered by the plan, not Medicare directly, and they're offered by private insurance companies. So a little bit more into these plans. So all the benefits of Part A, except for hospice care, which is still covered by your Part A, and all the benefits of Part B are all included in that plan. Prescription drug plans are usually included as well, but there are some that do not include drug plans. And they may offer additional benefits such as dental exams, cleanings, x-rays, eye exams, hearing aids, and so on. Medicare Advantage plan types, so there's a few different types. So health maintenance organizations, or HMOs, a lot of people are familiar with those. They have done away with a lot of the requirements for specialists like they have had in the past, so just keep that in mind when reviewing your options. You have PPO, or preferred provider organizations. Those are usually your larger networks or nationwide networks. You have point of service plans, which are a little bit more based on cost and if the doctor will agree to that. And then special needs plans, which are specifically designed for people who may have a special need, such as a chronic illness, or if you qualify for what we call dual eligibility, which is where you qualify for Medicare and Medicaid. So a couple cool facts about that, or fast facts rather. You must be enrolled in Part A and B, as well as live in the plan service area. So these Medicare Advantage plans are based on your zip code or county a lot of the times. So if you were to move out of your area and you have a plan, you may have to enroll in a new plan because it may not be available. You can't be denied coverage based on your current financial or health status, including your pre-existing conditions. There are no health questions usually with these plans. You may be required to use certain networks. That's where the HMO, PPO, etc. would come in. Coverage and costs vary by plan and may change year to year. Most of these plans don't change a lot from year to year, but always take a look at that annual notice of changes to confirm. There's an annual limit on your out-of-pocket cost for covered services. We call this a max out-of-pocket. So basically, it's the most your copays or coinsurances could ever add up to before the plan takes care of the rest for you. There can be monthly plan premiums on these plans. Just depends on the type of network and plan that you're looking at. And you must continue to pay your Part B premium to stay enrolled. So that's that $170.10 for most people for this year, 2022. So we've seen some trends here recently with Medicare Advantage where you can see from 1999 up to now, the enrollment in millions, or the percentage of people that have been enrolling, has been increasing slowly but steadily. So this is, of course, numbers up to 2020. I think it's increased even more here into 2022, just because more and more people are starting to see the benefit of some of these plans, and it just makes sense in some cases. So Medicare supplement insurance, or Medigap plans, those plans are also going to pick up costs not covered by Medicare. The way that these work is it supplements your original Part A and B. You can't have an Advantage plan and a supplement. You can have one or the other. There's about 8 different standardized plans. There are certain ones that are more popular than others based on the coverage that they offer. Certain states are going to have different standardized plans than others. So again, based on your area, make sure you do a little bit of research on some of those or find a qualified agent to help you out. And again, these are offered by private insurance companies. Medicare supplement insurance or Medigap, so they help with Part A and B deductibles in some cases. Again, there's multiple types of supplements. They're lettered plans. So between companies, the same letter plan will have the same coverage, but different letters can have different coverage. So copay is coinsurance, provider excess charges, your extra cost for those lifetime reserve days, the cost of blood transfusions, cost of foreign travel emergency up to a plan limit can help cover. Now, the Medigap plans do not cover prescription drug, your routine dental, vision, or hearing, eyeglasses usually, extra days in skilled nursing facilities, custodial care, long-term care, etc. So there's a few things that they're not going to include, but there could be discounts on some of those things depending on the plan. So more fast facts on Medigap plans. You must be enrolled in Part A and B, as well as live in the state where the plan is offered. You can usually take your supplement with you unless it is tied to a region, because there are specific plans for that. Again, just ask your agent if your plan can be taken with you if you are looking at it. No medical underwriting up to 6 months after enrolling in Part B. Basically, you get a small guaranteed issue window around you turning 65 or getting Part B for the first time, where you do not have to answer health questions to enroll. There's nationwide coverage, and most plans have no provider network. Most plans are also guaranteed renewable as long as you pay your monthly premium. If you miss paying your monthly premium and you lose your coverage, you may have to re-enroll through underwriting and health questions. Plan premiums can vary. That's based on company, age, where you're at, and so on. So there's a few different factors, but happy to get you quotes. Feel free to fill out a form on our website or give us a call if you ever need quotes on a Medicare supplement. Plans with more coverage generally have higher premiums, and you must continue to Part B premium to Medicare, continue paying it to have coverage. So these are some of the examples of the standardized Medicare supplement plans here in Kentucky. These are the ones that we offer. So if you live in a different state, your offerings could be slightly different. Again, find a local agent, or if it's a state we work in, feel free to come to us on our website or give us a call. So some of these plans are no longer offered because they've been aged out. If you're already in the plan, you can continue to have it or may be able to enroll in a different company with the same plan as long as they offer it. But you'll see a bunch of different options here. So choosing carriers, how do we kind of look at different carriers? So there's different ratings for the carriers. So of course, a higher rating a carrier has, usually the better, which most major companies are going to have a good rating. Underwriting requirements. So there are certain underwriting requirements where plans will be a little bit different. And so if you have to qualify for a new plan, or if you're looking for a cheaper rate and have to go through that underwriting, some plans may be lighter on underwriting than others. Monthly premiums can vary from plan to plan. Some plans offer household discounts, whether that is just someone else over 18 living in the home with you, or you both being on the same plan. Like say we have a couple, they're both enrolling in the same company, they may get a discount for that. Additional benefits, so some may have a fitness membership or telehealth or something like that included. And some people just like having a brand name. So your major carriers. So just keep an eye for that. And now we'll get a little bit into the Part D prescription drug coverage. So there's a couple different ways to go through that, but we'll continue this in our next video of this Medicare 101 series, just because we don't want to overload you. Nice little tidbits. So again, my name is Justin with Kentucky Health Solutions. Thanks for coming and watching our video. Feel free to like and subscribe to the channel as it helps us out, as well as will help you get notified anytime we upload new content. Have a great day.